Okay, we'll call the Health and Human Services Committee meeting to order. And first order of business is to accept the minutes from our June 26, 2024 meeting. Hey,
Oh, no, I moved them.
all those in favor?
Aye.
Aye.
You're only sitting in on this.
I know, that's why I gotta get my motions in.
Department of Social Services, Tammy.
I'm thinking one second on the list, I didn't realize.
Oh, I did skip some.
They're not here.
Okay, right.
You sure?
So, okay, go ahead.
So I'm here early. The first thing that I had on listed was information about the Family Centered Case Management funding announcement and a hiring request. This is funding that we heard mentioned in the State of the State address. And I shared that at the time. Information came through a different budget. Guidance documents I received after that, but we continue to wait for the guidance to actually be released to us at DSS. So it finally came July 16th. And it comes with the guidance around the intent of the service pool, and it's for families who are having difficulty stabilizing their households and transitioning towards greater financial security. We have a lot of those people. We've talked about all the homeless population we've had in the past. The allocation for Washington County is $165,385. And it's to cover a period of service of July 1st. Remember, this just came out July 16th. July 1st through June 30th. It's 100% federal funding. Their intent is for us to increase services by hiring someone to do something more than what we are currently doing. So we are in Washington County providing services to this population, additional services that are discretionary on our part to do with the support of the board in the past to hire people for that. But this would have to be over, if we accept this money, this would be for services that are over and above that. So I would be looking to add at least one person. I think it's probably most logical to strictly ask for one at this time. That is something that I've talked with Danielle about when we were meeting to discuss the staffing request for this coming year. But I said to her that we're still waiting for this money to come through, and that I would be probably, if it did, that I would be asking for that to start sooner rather than later. We do have to submit a plan to the state that provides a perspective overview of how we intend to spend the money. That's due by August 30th. The title of the person that I would like to hire is a caseworker assistant. We have two of those right now. That's a grade 12. It's a base rate of $24.22. We are able to include the fringe and the administrative overhead, which is not something that we generally are able to include in our with our funding allocations. And for a full year of a person in that title, adding in the fringe and administrative overhead, it would be $68,654, which would leave over $96,000 as a balance to that total allocation that we received.
So is this a one-time shot?
So that was a huge question. They have scheduled a WebEx for question and answers for August 8th. I knew that it was going to be a question as soon as I asked about a staffing, request. And just yesterday, OTDA released back to all commissioners the answers to 3 questions, one of them being that sustainability. And what they have said is that it is a position. Where did I write that down? But regardless, that they understand that it's something that has to be included in the budget in future years. So it would still require them to pass that through, but they have every expectation that it will be. So in the absence of that, if we were to be left with an additional person and no longer have this funding, without any other measures, we would be able to claim that person to our rest of our, programs as we do with the rest of our staff. And that should be a 75% return at that point as opposed to this 100.
What would you be able to do with the rest of the money?
That depends on what we write into the plan. And I do a little bit later in, once we move past this part, I have a suggestion.
Well, wait, there's more.
I have, I have some thoughts. I'm hoping that I still don't have a way though to spend it all out. Based on, the amount that they've allotted here. But hopefully during the WebEx that's scheduled for next week, I'll hear other commissioners asking questions and get some ideas of what the tolerance level is of the state. But at this point, they're saying very flexible to meet the unique needs of the local counties. So
Would it be able to be carried over if you don't spend it all? Can you carry it over to the next?
it wouldn't be unheard of for them to allow that.
So you could hold it for the salary, you could hold enough to pay for that salary again next year in case the state doesn't.
Well, they're saying that they're specifying that that this pot is for expenses of July 1st of 24 through June 30th of 25. So I couldn't in my plan build in that it's for complete funding of next year. I could suggest that if there's rollover that we would be able to do that, but they have to be the ones to let us know that they're willing to do that, which they certainly may. They're gonna want counties to spend this out because they want counties to work on these issues.
Or you need us to move it to personnel?
I would like it very much if you would.
Listen,
And one thing I didn't ask you when you mentioned it to me, is there space down in your department to add another person? Because that seems to always be an issue.
It is always an issue. The particular area that the workers that do this function already are seated in is like an open U. So it is physically possible for us to put another seat in there. In terms of, do we have enough computers? We ordinarily would be at a point where they would have all been allocated, but we still have the computers that were purchased last year waiting to be deployed by IT. So I feel like we're in a good spot for that as well.
It'd be nice to write that in the plan too, their IT needs.
Sure. Yep,
Can't hurt.
agreed. Yeah, it does. It has broad language there about equipment and other program needs.
But if
Again, that I
there's
intend to
somebody, you need
capitalize on.
give them the tools to do their job, right?
Yeah, yes. It could be for new components for the cubicles.
so I think budgetary is gonna be concerned, even though the first year is paid for. And we're not sure that the funding is gonna continue. Yes, it's still 25%, but as we're about to learn, and those who haven't got a clue, the budget's very tight, so. I'm gonna go to the personnel, but I think that we are gonna have some real concerns with the budget this year.
And the thing that I would point out on that part of our DSS spending that makes things very tight is dealing with the incredibly large homeless population that we have right now. We have 192 people currently homeless that we are paying for. And a lot of that is county money. At that point, when it's through safety net, it's 71% county money. So if I can make headway with an additional person to work on helping those people find places to live, I think that would be to our benefit. There's no guarantee, but that's, there's gotta be places for them to move to.
I'll move to personnel.
Okay, second. All those in favor?
Aye.
Opposed?
Thank you very much.
Yeah, real quick follow-up on that, and we also send the budget to finance and kind of get that fall in place as well.
Personnel and finance?
So, well, the budget piece, we can send to finance.
Oh, okay.
And it can give us, even if it's a rough breakdown of how much is point one, how much is fringe, how much is,
Of what will go into
and
24.
we won't hold you to it later, but if we could get it in the budget for you, At least, because if we pass this person out, you'd probably like to recruit this person and get them
Yes,
up and running, so let's get your budget in place.
yeah, the number I gave, excuse me, for the dollar value is if I could get the person in to start by September first.
Right. Yeah, so we'll take that whole award and we'll recognize it, and just kind of a loose, how much is 0.1, how much is 0.8, how much is 0.4,
Will you want to recognize
the whole,
it,
the whole shot.
even what would be used in 25?
Yeah, and we'll roll it over like an inspector.
Okay.
We'll treat it like grant funding until we know different.
Okay,
Okay, so could we also have a motion to move into finance? First, second.
Let's go to personnel before we go to finance.
The
Well,
budget,
we're just moving the budget over.
Budget. All those in favor?
I,
thank you.
we're here to help.
in your,
Break that down.
in your packets, there should be another document that has the DSS letterhead on it. It's a proposal for purchase. So that is the next part of the story. I originally I foresaw a value in having some sort of a mobile office for our staff to use. Particularly because when they are going out to work with the homeless people, what I understand to be the case, and I can certainly envision it. They're going to these hotel rooms and they're just a regular hotel room. And there are generally, at least one adult and a couple of kids in there with all of the belongings that they feel that they can bring into that room. So more than a vacation suitcase. And it gets pretty packed. And then our workers are standing in a doorway and trying to have a conversation. There's no place to sit down. It makes it very difficult to engage the people and talk with them about what they truly need and to get them to, follow along with the things we're trying to encourage them to do. Also added to that, when they talk with them and meet with them outside, they tell me that a lot of other people in the motels come to them, whether they're Washington County or not, to ask questions or make complaints or whatever. So it sounds like it's pretty chaotic. I worry about their safety. So I have been thinking, what could I do to try to reinforce at least reduce their risk, I guess. I can't make them safe, but I can reduce risk while they're out in the field. So this was something I had been thinking of. And then with looking at the foster care ARPA money, I thought of additional ways that we could use it for foster care recruitment. Both of those pods of workers are in the same unit in my office. And so I initially, knowing that there was the foster care ARPA money, put out a proposal asking to use the foster care ARPA money for that. Luckily, I realized the shortcoming of my proposing to use something that was a lot oriented towards homeless, with foster care money, and then this homeless money came. So I'd like to purchase a van that we could outfit with a mobile office area in it. It would be something I would need to work on with DPW to try to envision and figure out how we would outfit that. And then utilize it for both our homeless visits as well as when our foster care recruiters go out. Lots of times they're going to festivals, and when somebody has seeks vendors for a festival, they want the people to be there for the whole time of that festival. So you might have, I know that I worked myself at the festival in Whitehall this summer, and it's like an 8-hour period. They need to get there earlier and they need to pick up afterwards. And all of that time is not beneficial for them to sit there as workers. So I would like for us to be able to negotiate with different festivals for a spot that they could be in with this van and not have to stay there for that whole time. It'd be better for our staff. It's a waste of their time to be there that whole day, but it's the commitment you make when you do it. So that's another way that I think you can use it for foster care. I'm sure that there are some other ways that we can utilize it through the department as well. I talked about this with Melissa, and we didn't want to take it a whole lot further. So then I just started searching online and came up with just like a sprinter type van. And kind of priced that out online and then looked at some other ideas for things that we could put in it, and that's where I come up with this 60,000 and then the $5,000 to add on to it, but it's definitely not a solid number. But I would like to be able to work into my plan for this case management money to pay for a portion of this van and also then use a portion of the foster care ARPA to pay for it.
Jimmy, one example you used was in the summer at a festival to use the van. I own a van and I can tell you in the summer heat, it's hot in there.
Yeah.
So I'm not sure that it would be feasible to use that in the summer.
At the festivals now, they haul in a big tent, like an easy up, but they're twice the size of a regular size easy up, and their chairs and table. So my thought would be that they'd set that outside of the van. And they would more or less bring people there, but then they would just be able to put their stuff back in. And instead of them hauling it like they are in the city, and that would be a storage point for us also, because at this point, they're hauling that equipment in and out of our office every time that they use it. I see that as a lot of wear and tear on them. But I understand what you're saying.
I certainly appreciate effort looking at this. I have concerns about security and safety. I have concerns that you're in a vehicle where anyone could knock someone down, jack the vehicle and take off. You know, so I'm concerned with people that are also concerned with going to motels and having the problems with motels and security and safety ourselves. Is there a way we can use money, perhaps just use this money to hire cabs to bring them here? Better security and safety.
To hire cabs and bring them here, is that what you said?
Yes.
We do have them come here at times. It would be a great deal of foot traffic coming in, and it also, most of them are not here local, so it's bringing them from Glens Falls. The ones that are actually able to work and manage the fact that they're homeless, it would be an interruption to them for that as well. Yes, we can bring them here, and we do bring them here.
I'm not against the theory is van. I'm just very uncomfortable having people in a van.
Yes, and so I
And
also.
a big security problem. I just really don't think it's a good idea to use it. Yeah,
We're out
I'll use
there.
this for.
We are out there with vehicles all the time. And we have the automatic locks, the fobs, that sort of thing to also try to increase the accessibility for them to get in and out quickly. My thought on this, and again, it's a matter of how we outfit it. I'm just trying to envision it in the back, there would be doors, and on the side, there would be a door. I would want there to be a way that the chairs could pivot from the front. Maybe that's where our staff stay, is on that side of, say, a table, that the clients get in first and they're in the back part. Where there are still doors, you know, I don't know, but
I
yes,
still think there's severe safety issues. I think you throw someone, knock your caseworker down, take the vehicle and run off with it.
they can do that now. They can do that now in the hotel room.
Put in a hotel room, like there are more people around the whole hotel, and then isolated in one space.
I recognize that this is a difficult thing to envision and that it will take work. If we were able to approve it, it would take work to try to assure as much as we can for how we work it inside the van, for the accessibility of people that have difficulties in their mobility, as well as people getting in and out safely away from potentially elevated finance.
Could you use this funding to possibly get a off-duty sheriff deputy to go there, plain clothes, and just hang out with the van? I mean, I don't know how often you go to these hotel rooms and how long your visits are. But if you could, you know, do a 4-hour block for the sheriff deputy, have him there for security. And the other thing is possibly putting a GPS locator on the van to motor vehicles. Because I agree with Dave, it's safety, but I also know that you're kind of stuck between a rock and a hard place. You have to provide these services, and which is the best way to do it, and if you can use some of the extra grant money the hired sheriff deputy that might go out and, or hire the sheriff's deputy, you know, to block, you know, Jeff to allocate 4 hours.
So we do contract with the sheriff's department for the person that's in our lobby. We also contract with them for an additional investigator. We have wonderful collaboration with them in our county, where if there's ever a time that we're going someplace where we think our safety will be an issue, they will send someone with us. A lot of these hotels are outside of our county. And so I'm not sure that the sheriff would be able to send a deputy. I don't know how that would work.
Jurisdiction thing when it comes to.
How
the
far,
sheriff's
how far away do you go?
Glens Falls and South Glens Falls
department.
and Lake George.
Remember-
So they go,
One-time contract.
Yeah, oh yeah.
So we might solve the issue until July next year, but after that,
If it goes that far.
the purchase of a van.
well, what you're talking about, additional help for
Oh, yeah,
sheriff and.
yes.
Well, I was just thinking, you know, a long-term solution, maybe we work with the county. This problem isn't going away. If anything, it's going to get probably worse.
I'd like to think that it's getting, that the number of people we're housing is getting better. I think we're on the decline now, but it's still huge. But yes, the volatility of the situations, it's not gonna get better anytime soon.
Do your caseworkers ever travel in pairs?
Yes,
So I think that is a big step towards security.
yes.
Do they always travel in pairs?
No. Anytime that they can foresee an issue, they do as well. Currently, the caseloads really mandate them trying to get their work done rather than spending their time, along with somebody else, but they do work very efficiently in the field. But yes, they do. We also go through a lot of training, a lot of de-escalation training, a lot of awareness, facial awareness. Get yourself out of there. Don't engage in that battle, just leave. A lot of training like that.
I don't mind using men, but I do have some real issues with security of an individual being with another person. Especially homeless people, you really don't know who they are, what their capability is. Just this morning, I was walking outside and asked someone politely to not smoke here. He was downright rude to me.
If it's the wishes of the county that we have workers go together whenever they're going to the motels, our workers would be delighted with that. And with having 3, we would still be able to make sure that there's coverage here in the office. If 2 were out together.
Well, if this van comes to a possibility, I think anytime it went out, I wouldn't think of going out with less than 2 people. Wouldn't even think of it. And I understand your concern, Dave, but I would rather be with a client in the van than I would in a motel room. So I think the risk for something nefarious to happen in the room is much greater than out in a public parking lot.
And is privacy an issue with
Yes,
talking in the
if they're
doorway
talking
of
outside,
the-
yes, yeah, and if they're outside, yes.
I think cameras inside the van would be a good idea. Well. I am afraid that your numbers are low. Sprinter vans are expensive and outfitting them is expensive. I mean, if we could get some of it done here.
Yeah.
At DPW, that's gonna save us a lot of money, but was that a state contract number on a Sprinter van?
No, it was just a web search. I didn't want to take the time for DPW to follow me down the rabbit hole at that point.
I paid 78 for the veterans. But
Yeah,
the-
right around 80.
but they
Is that-
have the
is that
wheelchair
cost?
lift
They
too.
both have wheelchairs.
But I mean, that's kind of a,
So that's,
kind of a safe zone probably. That 65 to 75 is probably a safe zone.
And there is
90.
that funding in, especially if we're dividing it between factors of the ARPA and the case management funds.
And if this turns into a 1-year thing, got the van coming out,
Yes,
so.
and if we solve homelessness, we still have a van that can be repurposed for the county.
You really are great.
Our vehicles get turned over to the DPW pool now, right? So.
I love a glasses half full commissioner here, us.
Got a dream. We were nearly at it before the pandemic.
Any other discussion?
Do you need a motion to go to finance with this?
Yes. Yeah, and at least what I would like is, confirmation that I could build it into the plan that I'm requesting approval for through the state. And hopefully I can get information on that rather quickly also. But I recognize you wouldn't necessarily wanna,
So you have to have the state authorize the purchase of
they
it.
have to authorize the purchase of the plan to spend the money. So the plan has to, would include this as a cost, and then they need to approve the plan.
So I think that those part of it, we should have plan and include the plan, security backup, security measures for people. Yeah, I don't, I'm still uncomfortable with it.
It's been discussed, it's been a long time standing. Back there was a point where we talked about, the spray, the pepper spray. There's been a lot of different discussions about what we could also give staff. The thoughts have been that it could just as easily be turned on them. It is not legal for them to carry a weapon.
Yeah, a lot of that is considered.
How about hornet spray?
I don't know ordinance.
I think it would be a
And
little
then
bulky to carry.
Then you have liability issues. You spray them, they'll sue you.
It's a great. And sheriff's cars at least, I have.
Yeah,
Forget, I think that's.
It would like nice security gate between the front and the back, and that way when they are interviewing, they have your car keys, but then they lock that up, that way nobody can get up in the front.
That's exactly what I was thinking, because I have a front seat that has 3 toggle switches, and one of them turns the chair. And so if they stayed in their driver's seat
Mhm.
and turned the chair, now they got their chair.
Mhm.
Maybe they have a table in front of the computers, and you have a gate. There's a-
Or a screen's a better idea.
Yeah.
They can't throw it with, maybe an opening that needs people sign things to fill things out, you know, where they're.
And those would be the things that I would want to talk with at least Jamie Madison from the DPW to get ideas on, but it sounds like you guys are open to information also for suggestions on it. More than I do know what is available.
Trap door underneath so they can just. hit the
How about an
button and
eject
drop
switch?
out.
I've always wanted an eject switch.
You got some.
You have to just go right out the top.
Yeah, for the people in the back.
Yes, yes.
So, we would be, you're asking us to move to finance
I'll move that to finance.
second. All those in favor?
Alright,
Aye. Opposed?
Thank you. I do have also in your packets the budget resolutions. One is a transfer of $5,850. That is to move the APS, some APS ARPA money to appropriately attribute the cost of the high capacity scanner, which I had mentioned us purchasing at the May committee meeting. We discussed purchases at that time, and there was consent about that, just as in the right, that amount is not in the right appropriation code right now.
So is that something we can do here, Al?
Send it to finance.
And motion to send that to finance? It's good. All those in favor? Aye. Opposed?
The other is for an amount of $2,583. And that is to balance out a computer equipment appropriation. We had purchased computers this year. And then ended up with Terry's recommendation, getting computers that, had more RAM than what the model was that we based our original, estimate on. So it's a matter of moving that. There also was other equipment that we purchased that was lower cost than we had budgeted for, so some of the, overage on the computers has been absorbed through other things being less, but we have a difference of 2583 that we need to move between the two lines. And that is also moving from a 0.2 to a 0.4, which is why we need to bring it here today.
I'll move it.
Glad you're here.
Second. All those in favor?
Aye.
Thank you.
Opposed? Motion passes.
Thank you, Tim.
So then the last couple of things I have is just to say that on behalf of the DSS staff, I want to thank you very much for your agreement. And whatever approval was needed to be able to have food trucks here on Tuesdays, that is something that people are really happy about. And I'm grateful also that they were able to have that. Last, just yesterday, we received an LCM, which is a local commissioners memorandum. That's the way that the state communicates with us, giving us the 23-24 home energy assistance program, administrative allocation. We've been allocated $257,839 so far. Generally, there are years that we will receive additional supplements. That is not always the case, but it's generally the case. This amount, though, is down almost 63,000. If we don't get anything more, it's down almost 63,000 from what we received last year. Last year was one of the years that we had a supplement. We have in the past received much higher amounts. That's the money that we've used in leverage to do the equipment, the purchases, the rest of the building. Just wanted to, just informational.
Thank you. Okay, we'll do lead.
Good morning, or sorry to have been late. I just have a couple of quick updates for you on the contracts between Washington County and LEAP, and you have materials in the packet. So the first one is, just pantry data, pantry usage data for our food pantry contract, and I included in that percentage of change year over year for a couple of years and new households that we've been serving. So you can see that in 2024 year to date, you can see January through June, our lowest numbers really have been 256 households in a month. And the increase, there's been a monthly increase, although June was much lower than the others over 2023. We've had a total of 101 new households so far this year using our food pantry. Households or individuals.
Surprising the increase, based on the trend, it's surprising June dropped so much.
Yeah, it surprised me too, and I was trying to find a reason for that. Trying to, in just different policies and disbursements, things like that. I don't know what caused that.
But the number of households, the number of households is 17, that's in line with the rest of the year. So must be they had fewer dependents in there.
It could be, if the total new households was 17, total households was 112, which is still more than the other months, so I guess it's the increase is what we're looking at there, that's so different. However, last year, the difference in the increase between May and June went from just over 28% to almost 152%, so that was a huge difference last year between those 2 months. So there wasn't really anywhere to go from June of last year, that. So that's where we are, right now, and as far as our food pantry usage. And then we have reporting on our transportation program as well, so the page you see that is a spreadsheet is the report that we send. Transportation program report that shows the units of service and all of those things, here, this grant year to date. And contractually, we also, have to report on our outreach and perform a lot of outreach for the, to try to make sure that seniors in the county know what transportation services are available. So that list is exactly that, all of the outreach efforts that have been made by our transportation coordinator and her team.
Shelley, the
Yeah.
volunteer driver hours, is that, in line with past years? Just
Volunteer
curious whether
hours?
it's hard to get volunteers.
It is hard to get volunteers. We don't, that doesn't change much. We have a couple of volunteers that are pretty consistent. And that's about it. We are actually agency-wide, ramping up to do a little push for more volunteers in general, not just for transportation. But, we have had a hard time recruiting volunteers in general.
Join the crowd. Everyone's having the same problem.
Yeah, that's not just us.
It's gonna get worse.
Can we add Hartford Senior Citizens Club to that outreach?
Absolutely. Do that.
I will get you, a mail address or email.
Okay, that'd be great.
Thank you.
Send that along. That's it for me, unless you have any questions, let's just start our update.
But thank you for the outreach to the Great Meadows.
Oh,
See if we can coordinate over there with this one.
you're very welcome. Still working on that. I've spoken a couple of times with the deputy superintendent of administrative services there. And, he's been disappointed. We haven't been able to get in yet. He would like us to come in. We haven't been able to get in there yet, but he's still working on it. So are we. We'll just keep trying.
I'm just amazed, they waited almost 3 weeks.
Yeah.
For officials to come up and talk to the people up there. I mean, how do you let people hang out there for so long? Not knowing what's going on, I'm sure the phones are ringing, the personnel offices, and people trying to figure out what's available to them.
I'm sure they are. I've also spoken with, I'm not sure, you've heard this, and I've also spoken with and I forgot her title, but the person who coordinates EAP for the Washington facility. But she also assists with Great Meadows, and she indicated that the staff at Washington are also very nervous. There's a lot of concern there, which after speaking with Mr. Gross, that sounds appropriate. He said that anyone that is in the same position in Washington but has less seniority could be bumped for someone in Great Meadows. So this could affect both facilities. So she definitely would, and she has a little more control over that because it's just training. She would like to have us come in and do some training on resume development and interview skills and things like that. So we're working on that as well. So
Shelley, what's the hindrance as far as getting in? You said the deputy superintendent is supportive.
he is supportive. I'm not sure who it is that Nick's did for him.
Speed state.
I can find out.
Might be. Yeah, we'll try to find out. If I don't hear back from him by tomorrow or Friday, I will call him this week. But I've spoken to him a couple of times,
I'll
but.
go over his head right now.
Hmm?
I'll go over his head right now.
Good to know.
I will.
Yeah.
I have relationships still there, so I can
Okay,
probably facilitate that, and if I can't, I'll find out why. I don't see any reason why they wouldn't want this kind of assistance coming into the facility.
I don't even.
And you're not really looking to go down back into the jail, you're looking to be in the lobby where they come and go, and that's very common.
Exactly, just be accepted with staff. I'll be thankful for any assistance with that, because we are ready to go in and do whatever we can to help.
You bet.
Well, thank you all very much. I'm sorry to be late.
Okay, no problem. What else?
I can't see it.
They changed the election system.
Brandon passing out our annual report executive summary for 2023. This will also be found on our county website as well as the full report. The full report is quite lengthy. So like I said, it will be on our website if you want to look at the full report. So I'm gonna just go through this. So I'm gonna start on page 2, which is our health services unit summary. This is just a summary of what we've done during the year. We do list out the 2023 visits by town. When I say visit, that means home visits, like in the home. So our different programs are listed there with the different number of visits that we've made for each of the different programs. And I can get into more detail on those in the further pages. So if you turn to page 3, this is our state aid funding analysis. We are funded by Article 6 state aid for our core services up to 577,500. And then after that, it's 36% reimbursement. And those state aid funding categories are listed there. So you'll see that comparison from 2022 to 2023. 2022 was still a little off because we were still dealing with COVID, and we had a lot of COVID funding coming in to offset those expenses. And then down at the bottom is a summary of our revenue categories and our expenditure categories. And just to note, under expenditures, all of our salary for public health is under the public health category, even though we spend time in those different areas. And when you're looking at these expenditures and revenue, this does not include our preschool and early intervention. This is just strictly public health. So that's a breakout for 2023 for those different areas. As you can see with the revenue, the majority of our revenue comes from state aid and grants. And then moving on, page 4 is information about our immunization action plan. We do go out and do clinics at Washington County Farms and also the Washington County Jail. We did visit 3 farms in 2023. Our total vaccines administered for the year for all of our different areas is 226. And then I also want to point out, when we're out doing these immunization clinics, we're also giving out other public health information such as lead poisoning prevention and rabies awareness and injury prevention. So we did at the jail, we did vaccinate 34 individuals, and we go over there once a month based on what their need is and who has signed up for the different vaccines that we offer. And on page 5 is our lead poisoning prevention program. We did screen about 1,200 children for lead. We are required to follow up on any elevated lead cases that we receive. And then 6 of those did meet the criteria for a home visit. And the home visit is if your lead level is above 10, we are required to contact that family and try to get out into the home. And when we do that, we meet with our environmental staff from the district office in Glens Falls, and they're there to do the home assessment to find out exactly kind of where the lead is coming from within the home.
Did you see a big impact on your agency when they changed the lead levels? They decreased.
Yes, yeah, that was several years ago. I think it was in 2019, I believe it was, where they changed it, where we have to, they changed it to 5. So anything between 5 and 10, it used to be anything over 10, and then they changed it down to 5. So now anything over 5, we have to follow up on and try to contact that family. But we don't have to do a home visit until it's over 10.
I know there were some concerns then on the impact.
Yes.
Just curious how it played out for you.
Yes, it definitely made it, definitely increased our numbers on the numbers to follow up on. Yep. And then moving on to page 6 is our maternal child health program. In this program, we had 14 patients under this program, and we did 17 home visits. This, we have seen a decline in the number of visits that we've been doing, and it all kind of started during COVID. We weren't going out. So we have made communication with those referral sources that, we are back, up and running, and we are back out doing those home visits. So, but even though we don't make a whole lot of home visits, any referral we receive, they also get a packet mailed to them with educational information. And then down below, the prenatal program, very similar to our maternal child health program. We can go out and make visits prenatally as well. And then the next page is our early intervention program. There's some statistics down at the bottom. Early intervention is for children 0 to 2. We did have 238 children referred to us in 2023. Out of those 238 children, 149 were evaluated, and 89 qualified for services in 2023. And again, this program is, we can bill our service coordination visits that our service coordinators make to Medicaid. And then we also receive 50% back from the State Department of Health on anything that doesn't get paid by other means, as far as Medicaid or insurance. And the next page, page 8, is the preschool program, and this is for children 3 to 5. And right in the middle of the page, there are some statistics on how many children we served. We served 290 children in the preschool program. 188 were evaluated, and out of that 188, 169 children qualified. We had 19 that did not qualify. For about 90% of the children that are evaluated qualify. We are also required to provide transportation to and from the programs. Again, these costs are billed to Medicaid as well as reimbursed by the State Education Department, 59.5%. And then on the next page is our communicable diseases. This is just a summary of the different communicable diseases that we case managed throughout 2023. As you can see, anaplasmosis, which is a tick-borne disease, was at 89. That is an increase in 2022. We were at 53. Other ones notable, COVID, huge decrease in COVID. 2022, we had about 9,600 cases. In 2023, we're down to 2,400. Again, that is also due to the reporting. People are not having, they have home tests, so they're not everybody is reporting. But we also did see a significant decrease there. Going down through, we have our flu cases, influenza A and influenza B. Did see a significant decreases there as well in 2023. You'll see RSV at the bottom. That is a new reportable condition. That was not reportable to us before, but now it is. So we had 134 cases of RSV reported to us in 2023. Same thing with Lyme disease. We saw an increase there. In 2022, we had 274 cases, and in 2023, we had 300. And then you'll see the other diseases there as far as, and then obviously we also follow up on all of the STD cases that come in as well. And when I say follow up, we contact the patient, make sure they've received the treatment they should be receiving, make sure they're aware of the positive test results, no matter what the disease is, and then follow up with the physician if there's something that needs to change, or just to ensure that they've been followed up on. On the next page is our breakdown of our tick-borne diseases. And you can see in that chart up on the right, which I previously mentioned, we have been seeing an increase in Lyme disease over the past several years. Anaplasmosis kind of goes back and forth between the years, but it's definitely still out there. And the other one we are seeing in our area is the babesiosis. which is another tick-borne disease.
That is anaplasmosis.
The symptoms are very similar across all three. We do see more hospitalizations with the anaplasmosis and the babiosis than we do with the Lyme.
Well, what's the difference between the two of those, the babiosis and the anaplasmosis?
As far as symptoms,
Well, as far as severity of illness,
yeah, I would say when what we see the most hospitalizations is the anaplasmosis. But that could also be because there are more cases of anaplasmosis than what we have at the babiosis.
nasty stuff.
Yeah, and this year we have been going out and trying to do more education on that. We've been out at the county parks and also some of the trailheads, handing out information on how to prevent it, handing out tick kits. And along that same line, we've also been doing injury control for animals as far as, you know, dog bites and wild animals. And then down below is our information on our sexually transmitted diseases program. We do have a contract with Warren County where people can go get STD tested. It's by appointment, but it is once a week at Warren County. And we also partner with Hudson Headwaters on that and also the Ryan White program for HIV testing. On the next page is our rabies program. We're very busy right now. You'll see some numbers there. For 2023, we did respond to 368 reported animal bites. We had 60 specimens that were set for testing. Out of those 60 that were sent, we had 5 confirmed rabid animals. We had 2 skunks, 2 cats, and a fox. And we also hold our rabies clinics where we partner with the vets in our area to administer the rabies vaccine to animals. So we had 7 clinics and we vaccinated 467 animals at those clinics. And then on the next page is a summary of our health education program with all the different events that they've held throughout 2023. Just some highlights there. We did partner with the American Red Cross to sponsor 2 blood drives in 2023. Other things to highlight, our Tai Chi classes are very popular within the county, which we partner with OFA for those classes, and we had 131 participants total in 2023. And then our car seat distribution program is significant as well. We distributed 48 car seats to income qualified residents in Washington County. And then on the very last page is the WIC program. As you all know, we sponsored a WIC program, and over on the right is just a summary. They had 14,715 participants in 2023. And they also are back out in the community. During COVID, they were strictly doing phone interviews, but now they aren't seeing as much traffic at their community sites that they had seen pre-COVID. Mostly because people can still do it over the phone. So people are really preferring to just do that electronically, those visits. Any questions on any of that information? Or let's go quickly, but. Okay.
Got a lot going on.
That was a big increase in specimens sent for testing.
Yes, yeah, and I did a analysis of that. Just to see what, I didn't compare it to the previous year, but I did. The majority of that is bats. Out of the specimens set, we had 22 of those were bats, or I'm sorry, 24 were bats. We set 14 cats, 7 cattle, 2 deer, 7 dogs, 2 foxes, and then we had a goat, 1 sheep, and we had the 2 skunks. And with the skunks, both of them had come back rabid. So that's kind of the breakdown, but the majority are bats that we're mostly sending. Somebody wakes up, there's a bat, they get it out of the house, or they capture it, then we send it for testing.
Well, it's good that the number of cases were confirmed were down based on the increase.
Yeah. Okay, next on the agenda, speaking of rabies, we did have, one of our vet offices reach out to us, requesting an increase in their reimbursement rates for the, vet services that they offer. And this again is for specimen preparation, euthanasia, cremation, and also the vet services that they provide our clinics. The overall estimated increase in costs would be about $2,500, and it is 100% rabies grant funded, or state aid funded. There have been years where we've gone over and above our rabies grant, but then again, then we can claim it on state aid. And then once our state aid is maximized, then we could also claim it 36%. And again, these rates have not increased since 2018. So I'm just looking for approval to move forward with increasing those rates that we pay our vets.
All in favor?
All right.
Aye.
No,
To finance, so.
Already in your budget.
So those are the-
Finance.
You need the resolution to operate a contract, be signed by the chairman or anything like that.
If there's a previous one that says sending documents, we should be fine.
The next item on the agenda is a increased request for Durin. I know that last month we did bring an increase for transportation, and that was for their contract. Per their contract, they are entitled to a CPI increase, which we did bring last month, and it was approved. They have reached out to us. We have one child that is being transported to the Achievements Program, which is located in Watervliet, which is quite a distance for them to travel. So they are requesting an increase for that particular route. It is one child that's going there. The increase would result in approximately an increase of $29,000. And it is reimbursed at 59.5% through the state education department. It is within our budget. We would have enough funds in there for the 2024 budget year. And this particular child will age out of the preschool program at the end of summer of 2025. So I know this is a little bit out of the ordinary to ask for this, but they have come back to us and said that they are losing significant money or significant, they're losing money on every time they go down there, because you can only have the one child on this particular bus because of the distance it is. So within the contract, the child can't be on the bus for more than an hour. And if they were to pick up other kids to do other routes on the way or on the way back, it would put this child on the bus a longer distance, which would then go against what's in our contract. So I'm looking for approval to increase and do possibly like a one-page amendment. I'm not sure how we would work it out with the contract, but just to increase for this trip to this particular center in Watervliet.
That's a big number, so, I mean, should we look elsewhere, are there other transportation companies that?
No, unfortunately, this is a contract that we hold with Durin, and our contract with them goes through 2027. And when we put this out to bid the last time, they were the only transportation company that bid. And it might have been the last two times we went out to bid, they were the only one that bid for transportation. We have tried to work with school districts in the past. So that is something that we could also explore. I don't know if our preschool program coordinator has explored that yet. It would be the school district would have to okay that, and I don't even know what their rate, they would have to come up with a rate as well, in order to transport that child, and that's even if they have the availability, to be able to do that, to transport the child down. We also have parent transportation, but this is not a situation where the parent, because we do reimburse mileage to parents as well. if they're willing to transport, which is actually a big cost saver for us. But this particular situation, the parent is not able to transport. The parents get to pick which center they want to send their child to. It's not something that we decide. And this particular child, this is the one that the parent is adamant that this child goes to this particular center, in Waterville.
Do they have any other schools that are sending students to this school?
No, this is the only child in our county that's part of this program that's
I
going.
was just wondering if there was like another school, Saratoga County, that was going down, they could transport a kid from their school down,
Mhm.
and then Durham only goes to Saratoga back up.
Yeah, I don't know how that would
I
work.
would think you might still have the issue with this child on bus for more than an hour at a time. Having been through the system for 19 years, or 20 years. You know, this is the kid's program that's been approved, and that's the best one for him, it's where the kid should go.
Aren't there other people we transport from other programs, Tammy? Are there other kids we transport to school and stuff, other programs?
Not of that nature, no, there are certainly other CSE placements through schools, but that would be directly through the schools if they make those arrangements. We are built for CSE education and residence costs, but we're not part of making the plan on their transportation. And my guess is that those are for older kids than what you're talking about.
This is for the preschool program.
I think that might be something that would also be difficult for schools to accommodate.
There is push at the state level, for the state education department to, not mandate, but really encourage and work with the school districts to provide this transportation. But it's nothing that has been, passed at this point.
So it's for a year. approximately.
Yep, so this
And
particular
it's
child
age out.
age out and
And you have the money in the budget?
we do have the money in the 2024 budget, and it would not increase what we would project out for 2025 for our 2025 budget.
I seem to remember a student from Hampton. It was transported down to Latham. I think the person also required a aid with him. So we're paying for the aid, paying for transportation.
It's very costly.
And that would have been a school district.
Is that the radius, like 1 hour is the range that the parent can choose the facility for their child?
They could choose whichever facility, out of the list of approved facilities that we have, that we provide to them. And those are set by the state education department. So we have a list of those available facilities, and that's where the parent, that's where they pick from.
More to Scott's question. I assume those approved facilities are within an hour.
They would,
Yes.
yes, yeah, because then they would be over
Yeah.
the contract of being on the bus for over an hour.
Doesn't sound like we have a choice, really.
What's your audit bills? You pick up a lot in the audit bills, but we're paying.
Oh, yeah.
You pay so much, some of these things cost. Testing for school and preschool and.
Okay, we have a motion. That's she has anybody.
Dave made the motion.
Dave, any second, Nate, all those in favor?
Aye.
Opposed? Motion passes.
The next thing I have is the approval to request to apply for grant funds. We would like to apply for grant funds through the Walmart Spark Foundation in the amount of up to $5,000. And we would use this funding to purchase lock boxes for harm reduction, to distribute to the community to help prevent possible poisonings from substances. So I had spoken with the county treasurer about this, and he is okay with this foundation, with us applying there. So just looking for approval to move forward with applying for that grant. A one-time mini grant.
I'll move it.
Scott, Nate, second, all those in favor?
I
Aye. Opposed? Motion passes.
And then I do have just a couple things under program updates. We had some funds that came in after the agenda was completed. So I'm just requesting a resolution to recognize reimbursement from NACCHO for the infection control scholarship that we received. So we'd like to recognize $1,256 in our 2024 budget.
Someone did that. Second, this down, all those in favor?
Aye.
Aye, opposed. Motion passes.
And then the second resolution request that I have is we also received reimbursement for our chronic disease self-management program in the amount of $1,400. So we'd like to recognize that revenue in our 2024 budget.
Motion by Nate, second by Stan, all those in favor?
Aye.
Aye, opposed. Motion passes.
And then just a quick H5N1 avian flu update. As of this writing, there's been no detected cases of avian flu in dairy cattle in New York. There has been enhanced testing, and as you know, there's going to be enhanced testing for the county fairs. There are 13 states at this point that have infected dairy cattle, which is up from 1 from last month. And again, we received numerous updates from DOH, CDC, and USDA, so that's something that we are monitoring. The other thing I wanted to mention, and I know Public Safety had sent out a message over the weekend, there is a significant listeria outbreak. Some certain brands of deli meat, they did enhance that recall just yesterday to include another brand. So right now it's Boar's Head in Old Country. There's been 34 cases, 12 of those in New York State, and all of those cases have been hospitalized. So if anybody in your community needs more information on that, just definitely reach out and we can share that information. Any questions? No? Okay. Thank you.
Hey, Youth Bureau, so.
Good morning.
Be fairly brief. I just wanted to update everybody on the allocations that we've received, which is perfect timing. It's working as it should after they changed the program years. For our youth development program funding dollars, our youth sports and education opportunity funding dollars, and youth team sports. So for this year, the YDP, which is where the town and village recreation program funding comes from, is down just a tad bit from 59,860 to 58,764. We did receive youth sports and education opportunity funding, and that's reduced from 22,146 to 20,000. Youth team sports dollars increased a little bit from 27,244 to 27,729. And then the runaway homeless youth dollars that go to the Wait House, those increased from 175,917 to 231,383. And that's going to be for program year October 1 of 2024 to September 30th of 2025. So, you know, not this year, there was not that additional $10,344 that was allocated towards like an upgrade specific to facilities under the youth sports and opportunity. So that was eliminated. So the numbers are pretty good. I will be reaching out to the town and village programs just to see that we're on course and that you guys have a plan of action for spending the dollars that they were allocated. So that's a great thing. On our current funding stream, we're right in the middle of monitoring these programs that were funded for this current funding year. So in the monitoring process, she goes out to the programs, make sure that they have safety plans in place and, you know, make sure that the funding was used for what they said that they were going to use the funding for. So she's right in the middle of that process and monitoring those programs. And then, so that's it for our RAP, which is a resource allocation plan. That's kind of comes under this umbrella. But we are in the middle of working on the STSJP plan in collaboration with DSS. And we recently, I was part of a collaboration meeting, and in that meeting, which also included the probation department, it was brought up that maybe a family meeting / kind of conferencing mediation could be of benefit for those raised the age youth, and probation was part of that, and really thought that they could utilize that service. So we have added that into our STSJP arena of programs that we'll be offering for this coming year. And we're hopeful that for those that are raised the age, meaning like that 16, 17 year or age bracket, and those that are on probation and JDs, that we would receive referrals, and that we could bill back the state under the raise the age plan and get reimbursed. I think we put in the plan that was $1,200 per conference. So we're really trying to maximize that raise the age funding, which is 100% reimbursement for those raise the age kids. So we're hopeful that that will be a nice collaboration. As far as our YDP program, which was the Derby Park, PYD Derby Park program, we've had a consistent 10 to 15 kids that have been participating weekly in that programming. I talked to the police officer that's kind of assigned to the park, to Derby Park, and he said that the incidences of really any issues have really dramatically decreased. I'm not saying that's all because of our programming, but it definitely, there's a positive spin. I think next week they're gonna do a little community service project and cleaning up the softball field, or the baseball field. Diamond is filled in with grass, so I think that's gonna be part of what the kids will do as that activity. So that's moving well. And then we have 8 kids working in youth employment. And we preliminary conversations with Warren County on their contract that we have with them for the administrative youth bureau services. So that's looking like it may be a go, which would be an increase from 105,000 to 213,000 as it is now. So that was good, kind of some good news. We're still preliminarily talking about dollars and expectations, but so I think that's all I've got as far as updates. I have no action items today.
Thank you. Great.
Any questions? And I will be reaching out to everybody about those YDP funds.
Thank you.
Thank you.
Thank you.
Can you work with you?
I was gonna be brief.
It's only for anyone in attorney says you're
Yeah. I don't know, I've seen it bounce back in other people too.
Any other business? Let's adjourn. Adjourn.